Today, you'll see a group of physiotherapy students from McMaster University engaged in a simulated problem-based tutorial, or referred to as PBT. The problem-based learning approach was developed here at McMaster and has been adopted by healthcare professional programs all over the world. In all 5 units in the PT program, the students meet for a tutorial twice a week, and each tutorial generally includes 6 to 7 students and lasts for 2 hours. The purpose of this video is to give you a glimpse of what happens in a problem-based tutorial. We hope that by watching this short video, you will get a sense of the format of problem-based learning and the role of the tutor and the students. What you'll see here is just part of the usual process. The students have already opened a new problem, brainstormed topics, and created new learning objectives. Today, you'll see how students share the knowledge they found to address those learning objectives, share learning resources, and make plans for the next time they meet again. The tutorials usually end with some aspect of evaluation. It could be feedback to individuals, shared by peers or the tutor, and it also addresses group functioning. Because of our limited time, you're going to see glimpses of the different things which would occur in a 2-hour PBT. A typical tutorial would consist of the students reading the rest of the problem and coming up with new learning objectives before the end of the session. However, due to time restraints, we will skip this and jump to the feedback component, which, like everything else, will be abbreviated. Our scenario begins with the students discussing 2 of the learning objectives, also known as LOs, that were identified at the previous tutorial. This video will begin with the reading of the relevant part of the problem, and then the learning objectives that the students will be discussing will be identified. The healthcare problem consists of Sammy, a 17-year-old high school student who plays soccer. Sammy tore her right anterior cruciate ligament, which we'll refer to as the ACL, during a soccer game. And 1 week ago, she had a surgery to repair it. She is coming in to see you today at your outpatient clinic. During the subjective interview, she says that she has been stressed out because of her injury, as she worries it will prevent her from playing and getting a scholarship for college. She also reports that she spends most of her time alone in her room, as she does not want to interact with her family and friends. After the appointment, you realize that you forgot to ask Sammy what her preferred pronouns are, so you make a note to ask her next time you see her. The first LO we will be discussing is to create a problem list, SMART goals, and a management plan for Sammy.
Okay, so if no one else has any housekeeping, are we good to get started on the first LO? Okay, perfect. So some of the problems that I have listed as part of body structure and function are pain, swelling, and reduced range of motion. So one of the goals that I came up with is to reduce swelling in the right knee by the end of 2 weeks, as will be measured by a tape measure. So I found the Fowler-Kennedy guidelines on fowlerkennedy.com that outline the physiotherapy management for adults following an ACL reconstruction. So in addition to reducing pain and swelling during the first 2 weeks post-reconstruction, the guidelines also outline that we should focus on increasing range of motion, restoring full extension, maintaining flexibility of the hamstrings, and as well as addressing the person's balance. So based on these guidelines, for my goal of reducing swelling at her knee, I would use ice with her for 15 minutes. And then I think I also want to ask the patient to use ice at home as well for 15 minutes at a time, about 3 times per day. And just making sure to educate them to put a towel underneath the ice pack or the ice bag to prevent ice burn.
That was really well presented, Nina. I also found those guidelines and I really liked how they provided weekly progressions to the treatment. My goal was to improve the range of motion of her knee. So I created a SMART goal that indicates that I will increase Sammy's range of motion at the right knee by 30 degrees by the end of 2 weeks, as measured by the goniometer. I actually found a randomized control trial from the Australian Journal of Physiotherapy. The first author is Tristan Shaw. The purpose of this study was to investigate the effectiveness of quadriceps exercises following ACL reconstruction. 103 patients were randomly allocated to either the treatment group, the quadriceps exercise group, or the control group who weren't asked to do any quadriceps exercises. The patients in the treatment group performed straight leg raises and isometric quadriceps contractions throughout the first 2 postoperative weeks. The patients in the control group didn't perform these exercises. The researchers used a variety of different outcome measures postoperatively at day 1, 2 weeks, and 1, 6, and 3 months. The outcome measures included ones for isokinetic quadriceps strength and the visual analog scale for pain. The study found that the performance of quadriceps exercises significantly improved the knee flexion and extension range of motion measurements and reduced pain. Based on the results of this study, I would include isometric quadriceps exercises and straight leg raises in the first 2 postoperative weeks. The fit elements of my exercise plan for Sammy, based off of this study, would be for her to do the exercises 3 times a week, once a day, 2 sets, 10 repetitions in each set.
Is there someone else who found an example of an exercise program that focused on quadricep strength?
So I personally didn't, but maybe this is something that we can incorporate into the learning objectives for next tutorial.
I think that's a great idea, Mina. Are we good to move on to the next LO?
Before we move on to the next LO, I just want to bring something up. The fact that Sammy mentioned that she's really stressed out and that she's really troubled is really sticking with me. I'm wondering if this is something we can explore and create into an LO for next time, about what else our role as PTs would be in this situation. I just think we should really look into how experiencing a serious injury might negatively impact someone's mental health, especially since our patient is a teenager.
Manisha, I think that's a really good point, and I completely agree with you. If everyone is in agreement, we will add that as a new learning objective for our next tutorial. Does anyone else have anything else to add?
I think that's a great plan.
Okay, great. So let's get started with our next LO. So for this LO, we wanted to talk about how we would have a discussion with Sammy about what her preferred pronouns are, and we decided that we would role play how we would talk to our patient about this. I can be the physio, and does anyone want to be my patient?
Yep, I can be your patient, Nicole T.
Awesome. So I found a really helpful resource called Gender Identity and Pronoun Use, a guide for pediatric health professionals online from the Boston Children's Hospital. Are you ready to role play, Mina? Awesome. Okay, so hi, Sammy. Before we move on to me checking your knee and discussing your exercises, I wanted to start with a question. This is something that I ask everybody, as I do not want to make assumptions about what my patient's preferred pronouns may be. For example, my preferred pronouns are she, her. What are your preferred pronouns, if you don't mind sharing this information with me?
No, I don't mind. My preferred pronouns are she, her.
Thank you for sharing this with me. Are you okay with me using these pronouns in front of other staff and when you come in with your parents?
Yes, I definitely am. Thank you for asking.
That was really well done. Just to add on to this topic, I found an infographic from a website called genderbread.org. I'll be sharing my screen so everybody knows what I'm talking about. Can everybody see that? I think this would be a great resource to have in clinic, especially when talking to younger patients about preferred pronouns. I really like that it showcases the difference between gender and sex. This could be a great tool to use when training staff in your clinic as well. I can share the link after class for you to review.
Thank you for sharing that infographic, Manisha. It's really helpful to get a visual of the concepts that we've been discussing. Now, if no one has anything else to add, are we good to move on to feedback?
Well, I'll start with the feedback. I thought everybody did a great job today. You took turns playing a variety of roles, and you brought a wide range of resources from different websites and peer-reviewed journals. And I think you've got some great evidence to begin to start to create your physiotherapy management plan that we're working towards. Nicole T, I noticed how you facilitated and took the lead by initiating an LO, and you'd mentioned last time that you wanted to practice that. How did you find it?
Yeah, thanks for asking. So I definitely felt more comfortable sharing new information today as I reviewed my notes before tutorial, and it made me feel a lot more confident when presenting.
Well, good job. So next session, let's spend a little more time talking about group process. Thanks, everybody.
That concludes our tutorial for today. You'll see that we all took turns sharing the information we brought to the tutorial and the way we interact as a group, whether that be to share new information, elaborate upon the information that has been shared, or think about the ways we function as a group, including how we give feedback as well as receive feedback. We hope watching this gave you a better insight on how a problem-based learning tutorial within the McMaster Physiotherapy curriculum would look like.